everybody, I am That Nursing Prof and welcome to my channel. In today's video, I'm going to be talking about the ISBAR. So first I'm going to talk about it and then I'll give you an example situation. So first of all, what is it? It's a means of communication. It's a communication tool that we use when giving report to our fellow nurses and when calling the doctor and communicating with the doctors. So let's jump into it. The first part is the I, and that stands for introduction. So this is when you're going to introduce yourself, because we can't expect the doctors to know who everybody is, right? So you're going to say your name, you're going to say your job, so I'm the nurse, right? And then you're going to say your location, meaning like the unit that you work on, the floor that you work on, that kind of thing. The S is for the situation, and the situation includes the patient's age, gender, their current status, so are they stable or unstable? And then why are you calling? What's the reason you're calling in the first place? And so some things you could say, I'm calling because blah, blah, blah. I've noticed a recent change, blah, blah, blah. Or I've gotten the lab results back and this is what they say. So these are some reasons you would be calling the doctor. Sometimes these things are going to be emergent, right? Sometimes we're calling the doctor because it's an emergency thing. But then sometimes it's just like a casual, like, hey, call me when those lab results are in. And then you're just calling to give the updated information. So we can use the SBAR in many situations. So B is for the background, so the background of the patient. You want to give relevant details. You don't want to go into this big long thing about the patient and, oh, this started 3 years ago when they fell and then they did this. Like, don't do that, okay? The doctor doesn't care about that. They're going to be annoyed with you if you're wasting their time. So give relevant details. What's the most important stuff the doctor needs to know right now? So the presenting problems, right, their chief complaints, and then like any relevant history. And then, is this an emergency? If it's an emergency, don't spend all of this time kind of going through all this stuff. Let them know like, hey, this is an emergency, right? So tell them right away. So some examples of things you could say. He was admitted for XYZ disease on what date? So he was admitted last week. He was admitted this morning. So doctor needs to know this. Why is he here and how long has he been here? Or he has a history of AFib or something like that. Anything that's relevant to what's going on with the patient. A is for your assessment. So you're going to say, what did you see? Anything weird that you saw on your assessment and anything you did about it. So for example, you can say, I think the issue is this, or I'm concerned about the patient because of this. And then you also want to say the things that you've done. So I've done whatever intervention, because a lot of times the doctor will be like, well, what about this? Have you tried this? Have you done that? Right? So you got to let them know, like, these are the things I've already done, and that's not been helpful enough. That's why I'm calling you. And then finally is the R. This stands for recommendation or request. So what do you want? What do you want from the doctor? We gave our reason for calling, and now what do you want from me? So I want an order for this, or I want you to come see the patient. This is an emergency. I want you to come see this patient right now. Or sometimes you don't really know what you want. You know there's a problem. I've seen a change. I'm concerned. There's something going on with this patient, but I don't really know what to do about this situation. And that's okay. Nobody expects you as the nurse to be like the total expert on everything. But you sense something's wrong, you know something's different, you can call the doctor and let them know, like, hey, this is what's going on, this is what I've seen, I know something's wrong, but I'm not sure what to do about it. What would you recommend? So that's where the R comes in. So this is the ISBAR, and now I'm going to show you an example of this. Hello, I would like to put in a page for Dr. Brown, please. Thank you. This is Dr. Brown returning the page. Hello, I'm Andrea. I'm the nurse taking care of your patient, William Jones, in room 502. Mr. Jones is a 90-year-old man who's been A&O times 3, and I'm calling because he's breathing at 32 breaths per minute, and his pulse ox is now 84. He's on 2 liters nasal cannula. All right. He was admitted yesterday with pneumonia. He has a history of COPD and CHF. He is becoming increasingly confused, and his breathing is now labored, and I've noticed swelling in his hands and feet. The patient seems to be getting worse. I think the problem is related to fluid overload. I've increased his oxygen to 4 liters. I noticed at home he was taking Lasix daily. I'm concerned that he hasn't taken any in the hospital. Can I get an order for Lasix, and can you come see the patient? All right, let's do Lasix 20 milligrams IV now, and I am on my way. I'll come check him out. All right, thank you so much. Goodbye. Okay, so that's 20 milligrams Lasix IV push given now. All right, and you're on your way? All right, see you in a little bit. Thank you. So that was my video on the ISBAR tool. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.